Good morning, everyone, and thank you for coming to our press conference today. My name is Jamie Peddle. I am from Brampton. I am a founding member of the Canadian Autism Treatment for Medicare Coalition, and you can find us on our coalition page on Facebook. With me is fellow coalition member Sarah Ruth, who is originally from Niagara, but has called Buffalo, New York, her home since her sons were diagnosed with autism and discovered that autism treatment and services was much better south of the border. We are here today to call on the provincial government to stop dragging their heels with respect to the revamping of the Ontario Autism Program and to quickly move to implement reforms that would improve access to autism treatment for the tens of thousands of children with autism who have been on unconscionable waiting lists. I am a single father of 4 children. The youngest is an 11-year-old boy who was diagnosed with autism when he was a little boy and who was severely affected by the disorder. Like so many other children in Ontario who have autism, he needs medically necessary autism treatment. The treatment is intensive behavior intervention therapy based on principles of applied behavior analysis, known as ABA. The medical and scientific communities have known since the 1980s that ABA is effective evidence-based treatment for autism. Repeated studies over the past 40 years have demonstrated that due to the plasticity of the brain, early intervention treatment helps children with autism develop to their potential, and that many as half can be integrated into the school system and function at an average level. Applied behavior analysis treatment for autism is evidence-based and is the core healthcare need of children with autism. It is an investment that reduces support costs over a lifetime. Until the cause and cure of autism are discovered or a more effective treatment is found, ABA is the core healthcare need of children diagnosed with autism. Over the years, many provinces have launched ABA autism treatment programs. Ontario's program was launched in 2000. However, the program was not treated as a medically necessary health service to be delivered through the Ministry of Health with OHIP coverage. Instead, the ABA autism treatment program was assigned to the Ministry of Social Services. This is a fundamental error in public administration and program delivery. The department that administers welfare does not have the expertise or the resources to do the job. Since inception, the Ontario program has been plagued with unconscionable waiting lists. Over the past 2 decades, the Ontario program has been routinely subjected to tinkering by the provincial government, and today the program is in shambles. In 2019, there were 24,000 kids on the waiting list for treatment. The Government of Ontario then announced a revamping of the program, and today there are over 60,000 on the waiting list. The Public Health Agency of Canada issued a report in 2019 indicating that the prevalence rate of autism was 1 in 50. Early this year, the American Centers for Disease Control issued a report stating that the prevalence rate is now 1 in 36. More and more kids are going to be added to the wait list that will continue to get longer unless something is done. The American Psychiatric Association's Manual of Disorders refers to autism as autism spectrum disorder. It is a neurological disorder, and its treatment is a health issue. Yet the Medicare system in Ontario discriminates against newly diagnosed children with autism as their treatment is not covered by Ontario Health Insurance Plan. Because ABA is not covered by Medicare, the cost of providing medically necessary treatment has often fallen to the parents who are forced to resort to the private sector. The consequences are that many of our children are not receiving the treatment because of their family's inability to pay. This is not only un-Canadian, it is immoral. Children with autism should be able to access treatment using an OHIP card and not their parents' credit card. We are calling on the Ontario government to end the discrimination against autistic children by implementing 2 steps. Number 1, it is critical that the responsibility for Ontario's autism treatment program be moved to the Ministry of Health from the Ministry of Children, Community, Social Service. Autism is a neurological disorder. Autism treatment is a health issue, not a social service issue. Number 2, have OHIP cover the cost of the Ontario Autism Program. The cost of autism treatment in Ontario should be covered by OHIP. All other healthcare services are covered by OHIP pursuant to the principles enshrined in the Canada Health Act. There is no reason why ABA treatment for autism, whether provided by direct service or direct funding, should be excluded from Medicare coverage. The Ministry of Children, Community, Social Service has delivered the OAP by contracting it out to the regional service providers. In Eastern Ontario, the provider is the Children's Hospital of Eastern Ontario, known as CHEO. The argument that the Canada Health Act and Medicare should only apply to services provided by a doctor or a hospital, and that autism treatment is not delivered by either, is clearly false. There is no reason why autism treatment cannot be delivered through a medical facility. To those who say it can't be done, consider the current existing healthcare system of rehabilitation services delivering, which can be used as a model for the delivery of autism treatment through healthcare with Medicare coverage. The Ontario Health Insurance Plan covers the cost of inpatient rehabilitation care. Rehabilitation that takes place in an outpatient clinic, the home, or the community may be covered by OHIP. It may also be covered by the Workplace and Insurance Board, automobile insurance, or private disability insurance. Such rehabilitation healthcare services typically involve one or more members of a rehabilitation team consisting of psychologists, physiotherapists, occupational therapists, speech therapists, social workers, and nutritionists. Why can't we add board-certified behavior analysts who are specialized in autism treatment to the mix? The current shell game in Ontario deprives children with autism from OHIP coverage for their treatment. One of the advantages of transferring the OAP to the Ministry of Health is that federal funds to help pay for the program would be available from the Canada Health Transfer or any additional health accords that may be negotiated in the future. Recently, a wave of dissatisfaction with the provincial autism treatment programs has resulted in increasing calls for the federal government to work with the provinces to develop a national autism strategy. A key component of any such strategy should be the inclusion of autism treatment under Medicare, and that the provinces should use the opportunity to negotiate a funding formula with the federal government. It has done so for other health issues, including mental health, so why not autism? At the same time, the Government of Ontario should join with other provinces and the federal government to develop national service standards for autism treatment delivery. Over the years, many families have migrated from Ontario to other provinces and to the United States in search of improved access to treatment. This is an embarrassing and shameful disgrace. The raising of common standards of healthcare delivery is in our interest and would put an end to autism migration. Premier Ford, if you make these 2 things happen, you will prevent more families like mine from having to empty their bank accounts, get second and third jobs, sell their valuables, remortgage their homes, face bankruptcy, etc., to pay for autism treatment for their children. You'll also save many marriages that will otherwise end in divorce from the stress. We need Medicare for autism now. Thank you. I will now hand the microphone over to Miss Ruth. Sarah?
Thank you, Jamie. Good morning, everyone. Thank you for allowing me to be here today to speak on this very important matter. My name is Sarah Ruth, and I was born and raised in Niagara Falls, Ontario. In 2010, I moved to Buffalo, New York with my American husband and our then 4-year-old child with another baby on the way. The intention was always to move home to Ontario as soon as it was feasible for us and our family obligations in the U.S. were handled. Unfortunately, that intention was never realized and likely never will be. The baby, now known as Zachary, was diagnosed with level 2 moderate autism just before his 3rd birthday. In New York State, Zach had the benefit of needs-based early intervention therapy from the age of 2. Yes, before he was even diagnosed with autism, but once we realized he was completely nonverbal and struggling. As his parent with concerns about his development, I was able to make a self-referral to the early intervention program through Erie County. He was tested in various areas, including speech, gross and fine motor, as well as educational evaluations. Within 8 weeks of that testing, he was assigned speech and occupational therapists who came to my home several times a week to work with Zach. He was often frustrated when he couldn't communicate his basic needs. That frustration manifested into various maladaptive behaviors, including self-harm, headbanging, and elopement. We had specialized alarm bells on our doors so he couldn't sneak out of the house in the middle of the night, and we put him in swim lessons because he was drawn to water. 2 weeks after his autism diagnosis, his speech and occupational therapy services were increased to 1 hour 5 times per week and 1 hour 3 times per week, respectively. We also added in 15 hours a week or 3 hours a day of ABA therapy. Shortly after, those 15 hours were increased to 20 due to Zach's severity of need and his therapist being able to demonstrate his need for increased services. All of these therapies happened in my home under my supervision and benefited not only Zach, but myself and my husband, since we were able to learn how to best help him with his challenges. The ABA therapist worked in conjunction with the speech therapist to implement a picture exchange communication system, also known as PECS, to give Zachary the ability to communicate his basic wants and needs. Within a few weeks of implementing the PECS system, we noticed Zachary's frustration levels and therefore his behaviors had dramatically decreased. A simple thing like wanting a glass of water and us not being able to guess what he wanted would lead to hours of screaming, crying, and banging his head on the floor. By 6 months in, we were able to teach a still fully nonverbal child how to use the bathroom, amongst other various necessary life and educational skills. No one harmed him, withheld his treasured objects, or food or drink from him in order to teach him these things, a common misconception when speaking about ABA therapy. Proper ABA therapy provided by a competent, well-trained, respectful provider can mean a world of difference in the life of a child with moderate to severe autism, and in Zach's case, it was a complete game changer. It's true that Zachary's early therapy and education cost somewhere in the ballpark of $100,000 per year in those early years. But as the years have gone on and he has grown and improved and subsequently moved on from many of those costly therapies, that number has drastically decreased. My husband and I have never paid a single dime out of pocket for any of these services, nor has our private health insurance ever been utilized to fund such therapies. I know there are many who would say, well, it's not my child, so why is it my problem? I'm going to tell you why New York State invests so much into early intervention, not just for children with autism, but for any child with any disability impacting their ability to live their fullest life. It is because investing in needs-based therapy in a child's formative years has proven to cost on average 2/3 less over the course of their lifetime. The cost to feed and house and care for a child like Zach in a group home during his adult years is astronomical, and with the rising costs of everything currently, those figures will continue to go up. When that child's parents are too old, too sick, or they die and aren't able to care for their disabled children, their care falls to the government and ultimately the taxpayer. It saddens me to know how many children are languishing on never-ending wait lists, waiting for money that is a mere drop in the bucket compared to what Zach received. So many of those children age out before they ever receive the full funding. Zach is 13 now. ABA therapy ended when he was 5. He had gained so many necessary skills in just 2 short years it was no longer necessary. He no longer receives physical therapy for his low muscle tone. We just recently ended his occupational therapy services since his fine and gross motor skills are better than some adults I know. He still receives speech therapy, but at a slightly reduced rate. He no longer utilizes the PECS picture system as he can speak well enough to get his basic needs and wants met and continues to improve in his conversational abilities. Zach is on track to move up from a 611 self-contained classroom to a 1211 self-contained classroom. And at this point, I have every confidence that he will one day be able to live independently with some supports in place. Ontario, you have failed an entire generation of our most vulnerable children. They deserved better. Their parents deserved better. At this point, you're on your way to yet another generation of children being failed by a garbage system that is so tied up in red tape that very few seem to be able to navigate it timely or successfully. How we treat our most vulnerable in society is a reflection of that society itself. It saddens me to see that my homeland and my home province of Ontario, my own child, is not considered a person worthy of help and support to live his best life to the fullest. Had we not moved when we did, Zach would not be the happy-go-lucky kid who continues to grow and improve every day. Zach would have been destined for a group home life the minute his father and I could no longer care for him. That's not the life I want for my child, and it's not the life I want for my fellow Ontarians' children. The bottom line is pay now or pay later, but I implore you to do the right thing. Cut the wait lists, cut the red tape, and invest in our children now before it's too late. These kids deserve better than a third world country response to their significant needs. Thank you so much.
We'll take any questions if anybody has anything.
You said you're worried, you're irritated by the amount of tinkering going on by the government. It slows things down, but are you at all worried that moving of the program from one ministry to the other is just going to cause even more delays?
No, not really, because if you look at the Ontario Autism Program, when it was first put into place back in 2000, it's been changed 7 or 8 times. The Ministry of Children, Community and Social Service, they don't have the resources or the expertise to deal with a healthcare issue. Take a look at it this way. You have families in Northern Ontario who driving for hours to get treatment for services. Well, why not put it in a hospital, to get that treatment? You have to look at the ballpark figure of this whole situation. I'll give you another example. When my son was diagnosed with autism, I took him to the service provider, Aaron Oaks, when he was at the age of 4. And they told me that my son was not ready for ABA. That's what they told me. I said, well, this is a healthcare issue. The science has proven, since the 1980s that early intervention is the key. So a year later, we went back and they said, oh, your son is ready now. And then when we did our assessment, they said, well, we're only giving you 12 hours. But here it is, when you look at the science behind it, you realize that, okay, 12 hours is not enough to get these individuals, children, to adapt to society. So by having into the Ministry of Children, Community and Social Service, I mean, it's just a disaster. Think about it this way. Just imagine having cancer into the Ministry of Transportation. I mean, I don't think that would go well with the Cancer Society of Canada. You're having in a ministry that doesn't deal with a healthcare issue. So, next year, the Board Certified Behavior Analysis, they've been recognized by the College of Psychologists. And actually, July of next year, they'll be in there. So what a perfect opportunity to give OHIP coverage for children with autism treatment, So no, we're not worried about that at all. It should be in the Ministry of Health because at the end of the day, autism is a Ministry of Health issue. Autism treatment is medically necessary, and people should be using their health cards, That's pretty much it, yeah.
If I'm understanding you correctly, the idea is that as a social service, there can be wait lists and limits and budgets with caps, but if it was a healthcare, it would be based completely on need and it would cost whatever it costs to get it done. Is that what you're saying?
Yeah, absolutely. There's one thing that we as Canadians, we take pride in. We take pride in our public funded healthcare system. This is what we take pride in. 1/3 of our taxes goes towards healthcare, but yet families are not getting that healthcare they need. We also have a tendency here in Canada to point the finger at the Americans and say how life is far much better here. Well, I can honestly tell you this. If you're autistic, that is clearly not true. In the United States of America, They actually have laws that protect autistic people in healthcare and education. And even the United States of America, the USA Surgeon General, the Chief Medical Officer, has even stated that autism treatment is medically necessary and that ABA is the golden standard treatment. Board-certified behavior analysis are recognized down there as health practitioners. You know, in all 50 states, autism treatment is covered under their health insurance plan. You know, but we have a premier here who seems to think it's a Ministry of Children Community Social Service issue. And, you know, well, he always talks about, well, we're the only government that's paid this amount of money. Okay, well, that's fine, Doug. But what about the other 40, 60,000 kids? Don't they need a chance in life? You know, I met Premier Ford this summer. And I said to him politely, I said, Premier Ford, I said, you guys just negotiated a deal with the federal minister of health for money for new health accords. I said, what a perfect opportunity for you, sir, to say, hey, what about autism treatment? You know what he says to me? Oh, let me direct you over to our new minister. He's a great guy. You know, Parsa. You know, we've seen pharmacare. We've seen dental care, long-term home care, child care. Well, what about autism care? You know, group homes now are a disaster. You know, it's a 10-year plus wait now. If we don't invest in our children's future, you know, it's going to be a complete disaster. You know, just imagine being 60 years old and you can't take care of your child. Then what? You know? Yeah. Thank you.
Do you think it is just a matter of money? Is that is just the reason New York State is so much better is because it throws more money at the issue? Is that the real difference here? Or is there something more going on?
I would definitely say it's a money thing, and that, you know, when people hear about, you know, what my child's education cost in the early years, they go, oh, we can't afford that. Who can afford that? Nobody can afford that. I couldn't have afforded that. But really, at the end of the day, it's going to save money long term, because Zach is not going to be, you know, the last average I knew was $250,000 a year per year to house a child in a group home. For, you know, say from the age of 25 until they die, 65, 75, that's a long time of $250,000 a year. But Zach will be able to live on his own. He'll get a $50,000 budget from New York State every year, and that will pay for support workers to come in, help him with his budgeting, help him with his grocery shopping, help him do the things that, you know, he maybe still has struggles with, but he'll be able to actually live on his own. And that's what investing in him as a young child got them. And I'm telling you, they didn't do it because they were nice guys. They did it because ultimately this was the cheaper thing for them to do. This made more sense. And I wish people would, you know, get past that, you know, sticker price, that shock value, you know, initially, and go, oh, well, we can't pay that, and realize that you are going to pay that. You're going to pay a lot more than that. And you better start building those group homes now, because if we've got 10-year waiting lists now and 60,000 kids sitting on a wait list, that's not going to work.
The status of private insurance in Ontario right now for autism services? Is there any?
Well, for the private insurance, basically people are paying it for themselves, right? So, I mean, right now the government has the OHIP program. So basically you go and you get assessed by someone over the phone. So they talk to you on the phone, they ask you questions, and then they make a decision on basically how much money your child is able to get. But the private sector itself, like right now in the province of Ontario, you know, people got this money, and they're even having a hard time spending the money because they just don't have anybody out there to provide this treatment, right? So, it's a complete disaster. It truly is, and there needs to be something be done. It needs to be addressed as a healthcare issue for sure.
It's something I've never thought about before. And your standard employer paid health care benefits doesn't typically include autism services?
Well, no, I mean, that's something that I can't comment on when it comes to employers out there, but from my understanding, by talking to families out there in the community, their workplace does not cover autism treatment it's not covered in their insurance plan, like a dental or prescription thing. Yeah.
It seems like what you're proposing is going to be a very major overhaul, another one, of the autism program. Like, to make this covered by OHIP is going to take, like, possibly legislation. It's going to take an entire new bureaucracy. Moving ministries is going to mean an entirely new branch of the bureaucracy is going to have to start overseeing this program. To start getting space in hospitals is going to take negotiations with just about every single hospital there is. Is this really the way you want to go? Is that because it really does seem like it would completely upend the program, and just we'd be starting from scratch again? Is it worth it to have that kind of disruption? If you and the healthcare system isn't exactly great about wait times either. Are you sure that this is like the direction you want to go?
Oh, 1,000%. I mean, think about it this way. Take a look at the picture right now. We have a premier who says we're the only government that's paid all this money, right? This is what he says. Well, what about putting into the Ministry of Health? If you put it into the Ministry of Health where it belongs, you're actually going to have access to federal funds through any deals that can be renegotiated through health accords or any of that nature. So there solves your money problem right there, right now. I mean, you think about it right now. If you were to ask anybody who's a board-certified behavior analysis if they would like to be recognized as a health practitioner in the province of Ontario, they will tell you, yes, 1,000%. This is why they passed this for the College of Psychologists. I mean, take a look at it since 2000. We've gotten nowhere. 7 or 8 different changes. It's gotten nowhere. You know, when you have a healthcare issue and you need treatment, don't you think you deserve that treatment? Right? So just imagine, being into a ministry that deals with welfare. They don't deal with healthcare issues. So we're a big believer, even Canadians across Canada who believe in this. We're big believers on, it's a healthcare issue. It should be treated as a healthcare issue. Enough is enough. Our children need healthcare, and if we don't treat it as a healthcare, the wait lists are going to keep growing. You're going to see the provincial government not putting the money where it belongs. It's a disaster. I'm a big believer in, if there's a political will, there's a political way. Look what we've come since 2000. I mean, absolutely. It should be a Ministry of Health for sure. We're not concerned about that. I mean, look at this. Look at the program right now, right? It's a disaster. So.
Has any political party at either level of government embraced this idea yet?
Well, from a federal standpoint, absolutely. I've spoken to the Conservatives in the federal, and they're on board on this 1,000% actually. Mr. Justin Trudeau, well, that's a different story. Back in 2019, our Prime Minister had basically said that he was going to develop and implement a national autism strategy. Well, we're still waiting on that. In fact, in 2016, the Liberal Party of Canada they had a policy resolution in Winnipeg, and over 2,200 delegates overwhelmingly voted in favor to fund autism treatment. So, and we're still waiting on Justin Trudeau on that issue. So, and here's a guy who says, and I quote him when this resolution was passed, he said, "How we care for the most vulnerable people in our society is very important." And no action. But from your answer, there is on the federal scene, absolutely. From the provincial side, I really haven't been able to talk and sit down and have a meeting with the other parties regarding this, but that would be a good question for you to ask them.
Who indicated to you that the federal Conservatives were on board with this idea?
Well, let's just say that they support autism. Let's just say that, right? So.
What does that mean? Did someone in the party actually say that they were on board with this idea?
Well, from the meetings not from the meetings that I had, but basically just from the conversation, they basically support autism, and they believe that something needs to be done. So that's basically to sum it up, right? So, yeah.
Have you found, I've been around Queen's Park for a little while, that it's easier for opposition parties than governments to take the side of autistic kids?
I'm sorry, I never heard you.
I was wondering if you found that in politics it's easier for opposition parties than the party in government to agree with you and to take the side of autistic kids.
Are you worried that they'll change position when they get in power? I guess.
Oh, yeah. I you know what, I mean,
Always.
always, yeah. So, yeah. So,
Get to a certain age, you realize that what's said
Yeah.
before election versus
Yeah.
after election could be two very different
Yeah.
things.
yeah. But autism has been on the federal scene since back in 2004, ever since the Otten case has been around. So they know what's going on the federal scene, that something needs to be done. So, I mean, that would be a good question for you to ask them on their position, as well as the other parties regarding this Medicare issue. But, you know, from the people that I've spoken to, yeah, they know that something needs to be done. I mean, they just know it, right? You think about it this way. There's over 500,000 Canadians living with autism right across Canada. 1 in 36 are born now every day. When my son was born, the rate was 1 in 68. You know, this is a huge difference. So, you know, they know something's going on and something that needs to be done, right? So, you know, we're hoping for that, right? So.
Have you ever managed to get a meeting with Parsa on this?
Yeah,
Yeah.
I actually did. Yeah, I spoke to Parsa. You know, I spoke to Minister Parsa. You know, he's a great guy. I was able to basically talk to him about our position on the healthcare issue. And basically, to sum it up in a nutshell, they told me they would get back to me. So, yeah.
How long ago was that?
Wow, that was before they just left for the recess.
Like June?
Yeah, somewhere around that. Somewhere, yeah.
Okay.
He's a good guy, nice guy, but he told me he would get back to me on it, so I'm still waiting. Yeah. Haven't heard anything about it yet.
I'm good. All right. Thanks, guys.
All right, thank you very much. Thank you.